Have you ever had one sentence split your life in two, before and after? For me, it happened under fluorescent hospital lights, with my daughter already on a gurney, and a plastic anesthesia mask hovering over her face. A nurse leaned in so close I could smell the coffee on her breath. Her hand brushed my elbow. Her voice was barely louder than a breath. Before we continue, please hit the like button, subscribe to the channel, and turn on the notification bell for updates. Don't let them put her under. And then she walked away, just like that. No explanation, no panic, no dramatic scene. She simply turned and disappeared through the swinging doors, as if she'd never said a word at all. I remember standing there, frozen, one hand on the metal rail, beside my daughter, Cerise, and the other clutching my purse so tightly my fingers ached. I was 68 years old enough to know when something feels wrong, even when nobody else in the room is reacting. Old enough to know that danger doesn't always arrive screaming. Sometimes it arrives in a whisper. My name is Verelda Mornay, and I had brought my daughter to St. Barrow Medical Centre for what we had both been told was a straightforward procedure. Not pleasant, no, but controlled, planned, safe. That was the word everyone kept using, safe. Cerise was 42, too young to look so small under that hospital blanket. Her skin had gone pale from fasting and nerves, and her eyes were heavy from the pre-op medication they'd already given her. She turned her head weakly when she heard my breathing change. "Mom?" she murmured. I forced a smile I didn't feel. "I'm right here." Around us, the operating team moved with the confidence of people following a script they knew by heart. Stainless steel trays, soft beeps from the monitors, the rustle of gowns. A man in a surgical cap, later I'd know him as Dr. Halvan Rourke, the anesthesiologist, checked the IV line and said in the calm voice people use when they expect obedience, "We're ready to begin." Ready? How could they be ready when a nurse had just warned me not to let them sedate my daughter? I looked toward the hallway where she'd vanished. Nothing, no sign of her, no one calling after her, no one looking concerned. That made it worse. Much worse. Because if she had panicked, I could have dismissed it. If she had yelled, I could have blamed confusion. But she whispered, like she knew exactly what she was saying. The mask was lifted. Dr. Rourke nodded to the others. Across the room, the head surgeon, Dr. Senric Vale, was already gloved and waiting. Everything in me tightened. Was I really about to stop a surgery over one sentence from a stranger? Or was that one sentence the only reason my daughter still had a choice? I opened my mouth and heard my own voice cut through the room. Wait. The entire operating room went still. What happens when you stop a room full of professionals mid-procedure and you don't actually know why? That silence. It wasn't normal. Machines still hummed. A monitor beeped steadily. But the people, they froze. Every pair of eyes in that operating room shifted toward me, or toward a 68-year-old woman who had just interrupted something they clearly didn't expect to be interrupted. Dr. Senric Vale turned first. Slow, controlled. The kind of movement that carries authority without needing to raise a voice. "Ma'am," he said, stepping closer, "we're on a very tight schedule. If there's an issue, you need to tell us now." There it was. Pressure. Calm on the surface, but firm underneath. I swallowed, my throat suddenly dry. "A nurse told me not to let you put her under." You could feel it. like a ripple through the room. Not loud, not dramatic, but real. Dr. Halvan Rourke, still standing by the IV, gave a small, almost dismissive exhale. That's unusual. Do you know which nurse? No, I said. She leaned in, said it, and walked away. Another pause. And here's the part that didn't sit right with me. No one laughed it off. No one said, "That's impossible." No one even looked confused. Instead, they exchanged quick glances, subtle, practiced, the kind of looks people think others won't notice. Dr. Vale clasped his hands together. We have a fully certified team here. Every step is documented and reviewed. There's no cause for alarm. No cause for alarm. Then why did it feel like I had just stepped into something I wasn't supposed to see? I turned to my daughter. Cerise, did anyone mention anything unusual, any changes? Her eyelids fluttered. She looked at me, unfocused, her voice soft and delayed. No. Mom, they said it's routine. Routine again. But her tone, there was hesitation in it. A faint uncertainty, like she was repeating something she'd been told rather than something she believed. Behind her, another nurse adjusted a tray without looking at me. Wouldn't look at me. That made my chest tighten. Then why would someone warn me? I asked, louder now. Dr. Rourke stepped in smoothly. Pre-op anxiety can cause misunderstandings. It's not uncommon for patients, or even staff, to misinterpret things in high-stress environments. It sounded reasonable, too reasonable, like a rehearsed answer. Meanwhile, the mask drifted closer to Cerise's face again, subtle, gradual, like they were hoping I'd stop paying attention. I didn't. Instead, my eyes shifted to something small, something almost hidden, the IV bag. It was turned slightly away, but not enough. I leaned just enough to read the label, and in that instant, something cold slid through me, because I recognized the name, and it was not the anesthetic Cerise had told me she'd be given. Not even close. I looked back at Dr. Rourke, my voice sharper now. Why is that medication different? The room didn't just go quiet this time, it went tense. Why would a routine surgery need a drug that wasn't part of the plan? That question didn't just sit in my mind, it pushed forward, demanding space, demanding answers. I stepped closer to the IV stand, pointing directly at the label. That's not what she was prescribed. I saw the paperwork. Now the calm started to crack. Dr. Halvan Rourke turned sharply, his earlier composure thinning at the edges. "Excuse me?" "That medication," I said louder now. "It's not standard sedation." "Oh, so what is it doing here?" For a split second, just a second, he hesitated. Then he moved, quickly. His hand adjusted the IV bag, rotating it just enough so the label disappeared from my view. Too quick to be casual, too deliberate to ignore. "It's within protocol," he said, "a variation depending on patient response." A variation? That wasn't an answer. That was a deflection. My chest tightened. "Then explain it." Across the room, Dr. Senric Vale's tone hardened. "We are not going to debate medical protocol in the middle of an operating procedure." "Debate? My daughter is on that table," I snapped. "You're going to explain everything." The air shifted again, this time sharper, more fragile. I could feel it slipping. Control. Their control. Dr. Vale gestured subtly toward the door. "If this continues, we may need to escort you out so we can proceed safely." "Escort me out." The words hit like a threat wrapped in politeness. "No," I said, planting myself beside Cerise. You don't touch her until I understand what you're doing. For a moment, no one moved. Then the doors swung open, every head turned, and there she was, the nurse, the one who whispered, Idrissa Kelm, 34. Her face was tighter now, no trace of the quiet subtlety from before. This time she looked like someone who had already made a decision and was prepared to live with it. I need to speak with the patient's guardian, she said firmly. Dr. Vale didn't even try to hide his irritation. This is not the time. Idrissa stepped further into the room. It is exactly the time. You could feel the fracture now, not subtle anymore. Clear lines forming. I moved toward her instinctively. Tell me, now. She didn't whisper this time. That anesthetic, she said, nodding toward the IV, is used when they need the patient completely unresponsive, not just asleep, fully suppressed. My stomach dropped. For what? I asked. She hesitated, just long enough to make it worse. Then she said it. They're planning to extend the procedure. Dr. Vale stepped forward immediately. That is a clinical decision. Without consent, Idrissa cut in. Silence, heavy, final. I turned slowly toward the surgical team. You were going to do more than what she agreed to, while she couldn't say no. No one answered, not one of them, and that silence, it confirmed everything. But it also raised something even more dangerous. If they were willing to do that, what exactly were they planning to do to her? What do you do when the people holding the scalpel stop answering questions? You stop trusting them. The room felt different now, not just tense, exposed, like something hidden had been dragged into the light and no one knew how to push it back into the shadows. I stepped closer to the gurney, placing myself between my daughter and everyone else. You explain, I said, my voice low but unshaking. Right now. Dr. Senric Vale exhaled slowly, like a man recalculating a situation that had slipped out of his control. The pre-operative imaging revealed an additional complication, he said. Non-life-threatening but surgically relevant. We made the decision to address it during this procedure. I stared at him. Without telling her? It would have required scheduling a second surgery, Dr. Halvan Rourke added quickly. Additional anesthesia, additional risk. This is more efficient. Efficient. The word echoed the same way routine had earlier. Clean on the surface, hollow underneath. Idrissa stepped forward again, no hesitation now. They didn't update the consent forms, she said. No discussion with the patient. The plan was to proceed once she was fully under. I felt something shift inside me. Not panic, not fear. Clarity. I turned to Cerise, squeezing her hand gently. Did anyone tell you they might do more than what you agreed to? Her eyes struggled to focus, but I saw it, the confusion turning into something sharper. Something aware. No, she whispered. Just the one procedure. Her breathing quickened slightly. Fear was breaking through the sedation. Dr. Vale's patience snapped just a little. In complex cases, patients don't always understand what's medically necessary. I met his gaze directly. That doesn't give you permission to decide for them. Silence followed, but this time it wasn't uncertain. It was confrontational. And then Idrissa said something that changed everything. This isn't the first time. The words landed heavier than anything else in that room. There have been complaints, she continued, internal reviews, cases where procedures went beyond consent. It's been kept quiet. A pattern, not a mistake, not a one-time judgment call, a system. I felt my grip on reality tighten. This wasn't just about Cerise anymore, but she was still lying on that table, still moments away from losing control over what happened to her own body. I straightened. "We're done here." Dr. Vale stepped forward, his tone colder now. "If you walk out, you are putting her at risk." I didn't even hesitate. "If we stay," I said, "I'm handing you permission you were already willing to take." That was the line, the point where everything broke. I turned to the staff. "Disconnect everything, now." No one moved. Of course they didn't, until Idrissa did. She stepped in, reached for the IV line, and pulled it free in one clean motion. A sharp beep erupted from the monitor, then another, then alarms layered over each other in rising urgency. Voices overlapped. Movement snapped back into the room all at once. Controlled chaos. Cerise gasped softly, her body reacting as the sedation line was cut off before it could deepen. And in the middle of it all, I realized something chilling. We weren't just stopping a surgery. We were interrupting something they fully intended to complete, no matter what really happens when you walk out of an operating room, mid-surgery. Not chaos, not immediately. At first, it's control, quiet, controlled damage. Within 30 minutes, Cerise was moved out of that operating wing and into a recovery holding area. Not because they agreed with me, but because once a procedure is interrupted like that, they have to stabilize the situation before doing anything else. And that gave me time to ask questions they couldn't deflect anymore, time to demand records, time to refuse to sign anything new. By the end of that same day, I made the decision to transfer Cerise to another hospital entirely. It wasn't easy, paperwork, resistance, delays, but it happened, and that's when the truth began to unfold, not in whispers this time, in documents, logical payoff. The additional complication they had mentioned, it was real, but not urgent. A small mass, non-aggressive in appearance, something that required monitoring or a separate, fully consented procedure later on. But instead of informing Cerise and giving her a choice, Dr. Vale and his team made a decision internally. Handle it now, while she was under, while she couldn't question it, refuse it, even fully understand it. The anesthetic switch, completely intentional. It was a deeper sedation protocol, one designed to ensure zero responsiveness, even in extended procedures. And the most critical part, there was no updated consent, no signed approval, no record that Cerise had agreed to anything beyond the original surgery. Emotional payoff. I sat beside her in the new hospital room that night, the sterile, quiet feeling completely different from before, not tense, not hidden, just honest. "They were just going to decide for me," Cerise said, her voice shaking slightly. I nodded, yes. She stared at her hands for a long moment, and I wouldn't have even known. That was the part that stayed with both of us. Not just what they planned to do, but how close they came to doing it without her ever realizing. I reached over, taking her hand in mine. "You still had a choice," I said. "That's what matters." Consequence. Payoff. Idrissa Kelm didn't walk away untouched. At first, and the hospital suspended her for breaking protocol, interrupting a procedure, challenging senior staff. But once the internal review escalated, everything shifted. Her statement became central, because she wasn't the only one who had noticed. Records surfaced, other cases, similar patterns, procedures extended beyond original consent, justified internally, rarely questioned publicly, Dr. Senric Vale was placed under formal investigation. Dr. Halvan Rourke faced scrutiny for anaesthetic misuse. The hospital issued a controlled statement, but it didn't hold. Patients started speaking, some confused, some angry, some only just realizing what had been done to them, what had been decided for them. Legal action followed. Not quietly, not internally, publicly. And Idrissa, she wasn't just reinstated. She became the reason the entire pattern came to light. Final resolution moment. 3 weeks later, Cerise had her surgery, the correct one, at a different hospital. This time every detail was explained, every option discussed, every risk outlined, and every decision hers. I sat in another waiting area, another operating wing, same cold air, same quiet hum of machines behind closed doors. But this time no one whispered warnings, no one avoided my eyes. Hours passed, then finally the doors opened. The surgeon stepped out, pulling down his mask. It went exactly as planned, he said, and for the first time since all of this began, I believed it. I leaned back in my chair, the tension leaving my body in a slow, unfamiliar release, because this time nothing had been hidden, nothing had been taken, and nothing had been decided without her. Sometimes it isn't the surgery that changes everything. It's the moment someone finds the courage to stop it,